Child mortality rates in Nigeria have dropped significantly from 214 deaths per 1,000 live births in 1990 to 124 deaths per 1,000 live births in 2011. According to the most recent survey, child mortality rates have dropped to 109 deaths per 1,000 live births in 2015. This is a reflection of Nigeria's determination to improve the health indices of its children. Of these deaths, a combination of vaccine-preventable diseases like pneumonia, measles, and diarrhea account for about a quarter of all childhood mortality in Nigeria. Immunization, therefore, remains one of the most effective public health interventions for achieving better health outcomes for children under the age of 5.
More effort is needed in the rural areas if we are to succeed, and the two constructs we're interested in is coverage and equity. By equity, we mean that regardless of where a child is born, we must ensure that children everywhere in Nigeria, rural, urban, from rich or from poor homes, from educated or from non-educated homes, have access to vaccines. Only 25% of children are fully immunized. And even that 25% does not reveal the true picture because there's a lot of heterogeneity. For example, there's a huge gap between the Northwest and the Southwest. Northwest is 14%, Southwest is 81%. Rural dwellers record 25% coverage as against 62% in urban areas. By wealth quintile, we have 7% amongst the lowest and 80% amongst the richest. 12% coverage among children whose mothers have no education compared to 87% among children whose mothers have more than secondary school education. So if you do the math, you find that children in rural areas are more than 2 times less likely to be vaccinated than children in urban areas. And that's not acceptable. Sometimes the health facilities are very far from rural areas. And in such cases, if parents can't come to the health facilities, it is actually the responsibility of the health facility to bring the services to the people. But in order for them to do that, they have to have funding for the outreaches. If they are going to use motorcycles to get to the rural communities, somebody has to pay for the fuel. The supply of services to rural communities really has to be strengthened, and that's why we need a lot of advocacy, both to the federal and to the state governments, to increase the funding for immunization and increase particularly funding for operations, for getting the services out there to the people. On the demand side, there might be some cultural norms that serve as barriers to immunization, and these may be more likely adhered to in rural areas.
Ana rage aihuwa ne. Yasa da dama mutane da yawa ba sa sani.